Hi there, I am Tracy Black of don'tmesswithmama.com, and I am so excited because today we're going to be talking to Dr. Brady Hurst of True Health Labs, and we're going to be talking about hormones, which is a very hot topic, especially on the blog. It's probably one of my most popular blog topics, and I'm so excited to have Dr. Brady here because he's going to be talking about female hormones, a little bit about what they do, how we can address hormones, how you can get tested for hormones at home, which is exactly what I did. And I'll tell you about my story in just a little bit. But first, I wanted to turn it over to Dr. Brady so he can give you a little bit more information about him and his background.
Yeah, absolutely. Thanks, Tracy. I appreciate you having me on here. And I'm excited about talking about hormones today. And basically, my quick background here, I studied neuropsychology at the University of North Carolina at Greensboro. I then went on to a chiropractic college in Dallas, Texas. And I also did an extra 2 years in clinical neurology there, which was great. And then started practice. Now, I did say I was in chiropractic, and most people think of that as just as back pain, things like that. But I didn't get into chiropractic for that. I think that aspect is very important, but I got into it because of the paradigm. Is that when going into healthcare fields, you've got a few different paradigms. You have the medical paradigm, which is symptom reduction. And usually you go into a specialty, meaning that is the only thing that you know about, and anything else has nothing to do with anything, the rest of the body. And of course, early on, I knew that wasn't the paradigm I wanted. So I went into chiropractic because that is more of a whole look at the body and how to address things and support the body as it tries to heal, because it's trying to constantly heal. What are those blockages? How are we going to help those? And so I wanted that paradigm. And so, and of course we go over, and just as a medical school, the details in endocrinology and neurology and all these other subjects outside of back pain. So started practicing. I ran labs, of course, on all my patients because we were dealing with a lot of type of mystery illnesses. And so I eventually started this laboratory service that people can order lab tests themselves for two reasons. The first reason is that a lot of people go online for their health information, and they spend more time trying to understand that than a lot of times their treating physicians will. And so they might come across like a site like yours and read about particular sort of lab tests, and they'll go ask their doctor, and their doctor's eyes will glaze over, or they'll say, no, that's just BS. Don't do any of that. And they're like, well, I can't get the test done. And we don't want that to happen. And so we created a service that people can order those lab tests themselves and get those done. And of course, we have resources to help understand those lab tests. And then they can go back to their doctor much better educated about what's going on and force them to learn a little bit better. And so the other reason why we started it is that the pricing aspect of laboratories is absolutely astounding. The amount of gouging that goes on, meaning that the pricing that a lot of labs charge, or if insurance doesn't cover something, is astronomical. The difference, sometimes it's thousands upon thousands of % markup, and that's not fair at all to anyone. And so what we do is that we go to all these labs and we negotiate better pricing. And so we're able to get cash prices that are 80, sometimes 90% lower than what you could get at a hospital or clinic, or, a lot of times the insurance, they won't cover it. And if they don't cover it, they're coming back at you for the remainder. And a lot of people don't want to do that. So that's how we got here today.
I love it. And let me just tell you, from a convenience factor, to be able to go online, get the test, and have it delivered to my house is so much better than driving to the doctor's office, then driving to the lab, and then driving back later. I mean, the convenience factor is huge. So I am so happy that you guys offer this service. And I know my blog readers love it too. Again, the hormone blog post that I have is one of the most popular that I have, and people are checking out this lab test all the time. So we're going to get into the nitty-gritty of the lab test in just a little bit. But let me tell you my story just a little bit for my readers and why I wanted to do this. So I am 41, and right about my late 30s is when I was like, okay, something is amiss. Something's going on. I feel, like your emotions are just all over the place. Something's just kind of out of whack. And so that's when I first started looking up hormones. Like, is this something that I should have checked out? And that's when I came upon, just lab testing online, got into it, loved it. And so I had that done a couple of years ago, and recently just came to Dr. Brady in Truth Health Labs and said, you know what, I need to get this done again. And Dr. Brady's going to do a lot of education on this, on why doing a hormone check every couple of years is not enough. You need to do it a lot more because your hormones are constantly changing. But what I found was I could take steps without going sort of the synthetic hormone route. I could take steps with supplementation, with my overall lifestyle. And again, Dr. Brady's going to talk more about this, but I love the idea of not only having to take the lab test at home, never leaving my house and just doing it at home, right? But also being able to take control of my health, right? Using more holistic and natural methods. And Dr. Brady's going to talk more about that. And I'm so excited he's going to do this. So Dr. Brady, I'm going to turn it over to you.
Sure. Yeah. So let's jump into it. So when it comes to female hormone testing, there's a few ways of testing it, in the blood and in the saliva. And there are a few differences here. So when we test for hormones in the blood, they are testing what's called bound hormones. And these hormones, let's say we're going to mainly talk about your sex hormones, so your estrogens, progesterones, testosterone. I like to say they need to travel in the body in a taxi. And so they hook on to these proteins or taxis and travel around the body, and then they get out of the taxis and they're able to do their work. So when they test them in the blood, they're testing for the bounded, the hormones that are inside those taxis. And in saliva, what our saliva glands do is that they remove or they get out of that taxi and get into the saliva. So we can measure the amount of hormones that actually operate in our body. Because sometimes, depending on the scenario, they might be very much out of whack. There might be so much of the hormone trapped inside the taxis that there's not a lot outside of it to get the job done. And so we typically like to look at the ones that are outside the taxis, and these are called the free hormones. And saliva is the best way of doing it, because we want to know how much you have available that actually works in the body. And so so this particular test, the one that you did, it was a single sample test. So it's a saliva test, and it says during this snapshot of time, these were your hormones. Now, what I want to talk about is that in cycling women, this is not good enough. It can give some insights, but it's not good enough. What I typically recommend is doing a cycle-long test. And what this is that you take a saliva sample every 3 days during the entire cycle. And then what happens is that the report shows the waves that happen during the cycle of the hormones, because estrogen and progesterone should peak at certain times and then fall off at other times. And you don't always see this pattern. And what that means is that those hormones can be supported at different times during the cycle to help correct it, which is much better than just saying, you've got cramps, here's birth control pill, take it every day. Not good enough. We want more personalized medicine, and doing a test like that for cycling women is great, because you can really, really see those details. And so, but for postmenopausal, doing single samples can help out a lot too, because there's levels of hormone that postmenopausal women need to try to have in order for their entire body to be healthy.
I love that. And we had some questions from some of our blog readers of, would this hormone test, be beneficial if, they were postmenopausal? So that's great. So the single test would be really great for that. And I'm loving this idea of this test where you're sort of testing every 3 days within a menstrual cycle. That's what you mean by cycling, right? So that's fantastic. So tell us more about, give us the basics of hormones. What do they do? How do the various body systems kind of relate to hormones?
Yes. Now this can get very complicated, but I'll stay as basic as I can. Now, the sex hormones, they come from cholesterol, and your liver is the organ that produces the cholesterol for your body. So, if the liver is nice and healthy, you'll produce healthy amounts of cholesterol, and that will then transform into other hormones. And that is your sex hormones. That's your estrogen, progesterone, testosterone. And it goes also into a hormone called cortisol. And this is one of those highly related deals, is that sex hormones and your cortisol, and cortisol is a stress hormone that's released from the adrenal glands, they're highly connected, mainly because the same area of the brain that triggers the area of the brain that tells the ovaries to produce hormones also tell the adrenal glands to do the same thing. And those hormones themselves will go back and affect the brain. So it's like a cycle. So that's really important. And so, estrogen, of course, is a female dominant hormone. And it is very important that estrogen and progesterone stay in a nice ratio. And many of you have probably heard of estrogen dominance. That's where, for a long period of time, the female body is dominant in estrogen. Now, doesn't mean you have to be high in estrogen. It just means that you're dominant over progesterone. And this can cause a lot of health issues. So things like abnormal cycle lengths, heavy bleeding, PMS, sleep issues, that's having trouble falling asleep and staying asleep. Of course, your temperature changes, because estrogen plays with the brain in a certain area called the hypothalamus that will trigger that. Your hypothalamus, one of its roles is to maintain body temperature. And so when there's a dip in estrogen, or some estrogen fluctuations that go on, body temperature goes like that also. So you'll get these hot flashes type things. And so, yeah, again, the balance plays a role. Now, when you're going to your endocrinologist, are they going to test for estrogen progesterone ratios? No, typically not. But it's always good to look at that, because you might need support in one or the other. But again, that's even if they're in the normal ranges. And so that the ratio is very important to look at. Another aspect of sex hormones is testosterone. And I harp on this one a lot because it's actually very common. Testosterone should be at lower levels in women. And of course, in men should be higher. But we don't always see this. And in fact, it's very common for women to have higher testosterone levels. And what's actually happening is that they are transforming their estrogens into testosterone. And the way this happens is it's promoted by insulin. And insulin is triggered when you eat carbohydrates. So let's just say you have a Snickers bar. And of course, that has about, 300 grams of sugar or something like that in it. And so your pancreas responds by pumping out all this insulin. And insulin will go and transform your estrogen into testosterone. And what that means is that testosterone will start being a very dominant hormone. And so you'll get a lot of male dominant type of symptoms. You'll start seeing the hair thinning on that, especially on the scalp. You might even see some facial hair. The development of PCOS, which is polycystic ovarian syndrome, where you have these cysts that start growing on the ovaries. Your increase of heart disease goes up tremendously. So I always like to harp on that because it's typically seen in those with higher body fats because that's where that transformation typically happens in body fat. And so if there's more body fat and a diet that is prone to insulin spikes, so a lot of simple carbohydrates, it can produce those testosterone spikes also. So, and then you have other types of estrogens that the main one is called estradiol. That's your main, your heavy hitter estrogen. And then you have some other estrogens that are, they're less strong, and they're really meant in pregnancy, some of them, and to help expose the fetus to estrogen that isn't so harsh, I would say the word. So light estrogen. So that's the basic overview of your standard female hormones.
You know, I think this is so interesting. Thank you so much for explaining that. I know when you talked to me the first time when I had my lab test result, my brain was going on overload, because as you're talking, what I'm thinking is, okay, estrogen dominance was just something that came up for me the first time. It did not come up this time, which I was very happy about. But with that sort of ratio, estrogen exposure, so for blog readers out there, think about plastics, right? Or exposure to chemicals that might have estrogen in it, right? So, you know, a lot of the plastics that are out there, right, are exposing our bodies to that. So when I found out originally that I had the estrogen dominance, we did a clean sweep, right? Like got rid of all the plastic cups, the plastic food containers, really made a conscious effort to get rid of them in my home, wherever it made sense. And I was so pleased to find out on my, on the test that I had with True Health Labs, that estrogen dominance wasn't happening. So I just want to let you know, there are so many things you can do to sort of, work on your lifestyle. And just like what Dr. Brady was talking about with testosterone, right? PCOS, look at your diet, look at what you're eating. Those are huge things that you can do. And Dr. Brady, I was hoping you could touch on this just a little bit. So we had talked a little bit about how, you've got your hormones, but they can also affect other body systems too, right? So you were talking about sleep. I know, like foggy thinking, right? Or even digestion, which is not something that I think most of us see the connection with hormones and digestion, but there's a definite connection there. I'd love to have you talk just a little bit more about that.
Yeah, so from the digestion point, mainly estrogen has a big influence on digestion, and mainly because of its effect, again, that part of the brain called the hypothalamus. It's very, very sensitive to estrogens. Now, your hypothalamus also communicates with your gut. So if there are imbalances in estrogen, what you'll do is you'll see an abnormal hypothalamus, and that will, when it goes to try to signal the gut to work correctly, it won't work correctly. So it'll be a symptom of sex hormone imbalance is intestinal issues like IBS, but not just diagnosed things, but even things like bacterial imbalances can do that, because it's a domino effect. And that's the big thing here, is that we could try to tease out to say, these estrogens do, one or these things and are good for that and not good for this, but it actually has a domino effect on the rest of the body. And especially because hormones are measured in such small amounts, just a little bit goes a long way for these hormones. So yeah, again, it's the brain gut axis, we call it. It's really the hormone brain gut axis, and so that's a really important one.
Thank you so much for telling us more on that. I was certainly surprised when I found out about the digestion connection with hormones, like not being regular, right? You're talking about IBS or constipation or other things that are just not going every day. Those are all things that can absolutely affect your hormones or maybe a sign that you've got a hormonal imbalance. So
Yeah.
definitely look at all of those signs. And this might be a good segue, Dr. Brady, to tell us, okay, so what are sort of signs and symptoms, or what is like a good age to start getting tested for hormones or to look out for hormonal imbalance?
Yeah. So, typically in the menstrual ages is a good time to get tested. And, a lot of those symptoms, like, especially younger women, are going to have those symptoms like abnormal period lengths, heavy bleeding, clotting, and of course, mood swings, since estrogen has a huge impact on serotonin production. So you're going to see fluctuations in mood, and of course, abnormal weight gain. That's always a big one, especially the scenario where someone says, my diet's clean, I exercise 7 days a week, and I'm gaining weight. That's a perfect time to test, because there could be big time hormonal imbalances going on. There could be that estrogen dominance. There could be progesterone dominance, because a lot of women, they say, I don't want to, read about all this stuff about estrogen, and I probably don't want to take that. And so they just take a whole bunch of progesterone. And what happens is that progesterone ends up closing off or shutting the doors of estrogen into the cells. And that's called estrogen resistance. And so that can happen. And so, that goes on, and especially, getting towards the late 30s into the 40s, where the body slowly starts to change into the premenopausal type area. That's when you're going to see these intermittent hot flashes, mood changes a lot. Definitely cycles are going to start to look abnormal, things like that.
I love it. So it's not just for the over 40, woman like me. It's really for any woman who has had her menstrual period, but maybe having symptoms like you're saying, like the heavy bleeding, the clotting, mood swings, abnormal weight gain, foggy thinking, I know, is another one too. But also right around mid-30s or so, how often would you recommend women get their sort of hormones tested right around that age? It seems like at least once a year, starting in your mid-30s.
Yeah, and before I answer that, you bring a really good point. Is that let's see here. I lost my train of thought. Maybe I need to check my my androstenedione or something. Right. So we were talking about what symptoms. Yes. So if you go to your OBGYN and you say, hey, I have all these symptoms, and they're immediately just want to put you on birth control, that is the time to do that month-long testing. Because what's going to happen is that birth control will basically throw your hormones off so bad that it's difficult to recover later on, mainly because those hormones, they store in fat tissue, and you can become hormone overloaded for a long period of time. So that's another thing. When your doctor just wants to throw you on birth control, get this test done and bring them the results.
Dr. Brady, I'm so glad you mentioned that, because sometimes I feel like that is the catch-all, because that's exactly what happened to me. I was around 32 or 33 and was having symptoms. I think I was having mood swings, very intense cramps that came out of nowhere. I already had 2 kids, so I was like, what's going on? And that was the recommendation, was just go on birth control. And I was like, something's going on. I need to look for another solution. So I'm so glad that you're bringing that up.
Yeah, perfect.
Okay, so for the woman who's 35 plus, recommendation is every year, or you had even told me you could even do it a couple of times a year, because hormones are always changing.
Yeah, sure. So the idea here is that of course, you don't want to have symptoms, but you want to make sure that these hormones are good throughout the premenopausal type time. So basically in the 40s. So basically the amount of time I typically would do every 6 months or so should be a good, and that's just a rule of thumb, because when you're treating someone who, let's just say that, just like you were having all these symptoms and everything was crashing down, well, we want to retest pretty early after that. After we get on a treatment program and we make these changes, yes, you want to feel a lot better, but we want to see those patterns change. Because, are we getting, if we're working with bioidentical type hormones, are we giving the right amounts at the right times, which is, I think, is more important than the right amounts. It's the timing of those treatments. And so, yeah, we want to test early on and frequently to make sure that we're making that progress, because we might have to make changes along there until we plateau. And that's when we typically switch to a longer period of time, around 6 months or so, to make sure that the transition is smooth. And it's not just the sex hormones we're testing. We're also looking at those cortisol levels, because, we see a huge correlation between women who go through menopause like it's a breeze, and those who just go through it and collapse all the way. That balance between your sex hormones and cortisol, which is also a saliva test, making sure that those are okay tends to make the whole process a lot easier.
Yeah, and what I also love is that only with this lab test that you can get at home is where you can get also tested for adrenal fatigue as well, correct?
Yes, exactly. And yeah, and in fact, they can, in many cases, they can be done in the same sample, because both the adrenal panel we use and the female hormone panel, they're both by the same lab.
Yeah, and that's what I love. So that's what I wanted to find out. So when I first got my testing done, adrenal fatigue came out. So that was really good for me to know, so that I could make lifestyle changes, which we'll talk about in just a little bit. So Dr. Brady already talked about the lab test, the difference between a blood test and a saliva test. I am a huge proponent of the saliva test myself. I think it's just incredibly accurate. Love the test results. So here, I want to tell you about the user experience and how you do it. So I will post a link, to how you can get the same lab test that I got, as well as the month-long test that Dr. Brady's talking about, because they're both fantastic. And I'll give you that special link so that you can do that. But really, this is what happens. You order the kit, it gets sent to you. Again, you never leave your house, which is amazing. And all the directions, like everything comes in this neat little box, all the directions, the little vials, how to do the collection, it's all included in there. So there's really sort of no, back work that you need to do. You might need to prepare a little bit in advance in terms of, are there certain supplements or medications or things that you're taking? So if you do have questions, right, you can always contact True Health Labs and talk to Dr. Brady's team. But I personally thought that the whole process was just so simple and so easy to use. And I remember just being so excited. I'm like, let's get it in the mail. I want to get my test results already. So it was just a really great experience, and I appreciate that. Thank you so much, Dr. Brady. But here's the really cool thing is, once you send in the test, right, and you wait a couple of weeks to get the results back from True Health Labs, you can also elect to get them read by Dr. Brady or someone on his staff. And so this is really where it's fantastic. This is sort of the bridge, right? Because if you get the test results, you're not a doctor, I'm not a doctor, right? I'm not a healthcare professional. So it was great to get Dr. Brady's insight so that I could take those lab results and then go to the doctor, to my, primary care, and say, hey, check this out. So, I love that you guys offer that, Dr. Brady. I think that's such a great option. And so you can take that to your primary care, your alternative doctor, your functional medicine doctor, whoever you're kind of seeing, but definitely work with someone who's going to put you on a treatment plan. I would love Dr. Brady to now talk about, okay, so you got your lab test results. Now what? So definitely go and talk to your doctor, okay? So Dr. Brady's team won't be able to do sort of the treatment options with you. However, I did ask Dr. Brady to kind of just, briefly discuss some of the natural treatment options that are out there. So I'd love to have you talk us through that.
Yeah. Just to reiterate on that one, yeah, we do go over the lab reports in detail, so that when we get off the phone, you understand what the results are saying. But you do need to bring them to whoever you're treating with, right? Because we can't do physical exams, we don't have full histories, things like that. So it is very important. But we want you to be educated. We don't want you to be like, hey, hey doc, read these, and it's this female hormone panel that has all these ratios and graphs on it, and your doctor is going to be like, what? Like you need to understand that, just the basics, so you can walk in there and be like, hey, look at here, my cycle is supposed to look like this, and it doesn't. It looks like this. What can we do about this? And so I think that's really important. Some of the things that can be done now. Let's start off with, most people have heard of hormone replacement therapy, and so there's different types. So you have the pharmaceutical type, which is estrogen and progesterone. Now, the estrogen is actually made from female horse urine. When horses are pregnant, what they do is that they collect the urine and then they extract the high levels of estrogen. Now, this estrogen is not the same molecular estrogen that our bodies produce. It's different, and it's actually a very, very potent. And because of that, that's the reason why you have, a side effects list on that type of replacement that's a mile long, right? And so a lot of people then go to say, all right, bioidentical. We want things that match with the body, because they don't have so much of those side effects. I mean, you can still put yourself in these dominant situations, an estrogen dominance or a progesterone type dominant situations with bioidenticals, but at least they can be adjusted very easily. So the main estrogen bioidentical hormone is usually extracted from soy products, and progesterone usually comes from Mexican yams. And so that's one aspect. Now, the other thing is that in the female body, the brain actually signals the release of estrogen and progesterone. And so there's actually a lot of botanicals that can help and support that signaling, because it might be a signaling aspect. It might be a brain aspect that's going on. And so there are botanicals that can help with that. Also, as far as environmental chemicals, you brought it up earlier. That's a huge one. So you mentioned plastics like BPA, but there's actually other stuff. Well, to touch on BPA, we have to remember that BPA is also in some other things that are very common, not just water bottles, but your paper receipts that you get. They've got BPA in those too. And you don't just have to ingest them. These things can go through the skin also. So with receipts, I mean, you can run, but you can't hide, we like to say. So don't handle those things as much as you need to. Take pictures of them instead of saving them, type thing. And you have other environmental chemicals here. So, well, first of all, in that BPA, there's recycling symbols that you need to look for. So the bad ones mainly are when it says a 3, 6, or 7. Those are your bad ones. For BPA, your 1, 2, 3, 4, and 5s are typically okay, and those are recycle symbols you want to look for. Also, a favorite for most is box wine. You're going to have BPA in those, and the alcohol itself actually will help leach the BPA in to the wine, and canned foods too. And so the lining, what they're doing is that not only has BPA, but a lot of the newer cans have Teflon along with BPA coatings on the inside. So those are a few BPA ones. Let's see, you have Dioxins, that's another chemical that will that mimics estrogen. And what I mean by mimics is that when it approaches a cell, it hooks onto the cell just like estrogen would. And so the signal it gives to the cell is say, hey, cell, do what I tell you to do. These are called xenoestrogens. So BPA is one of them. Dioxin, that's going to be mainly in your animal fats, and mostly fish, actually. So a good technique is to remove the skin from the fish, avoid fried fish, of course, and that'll help reduce dioxin exposure. Your PCBs, that's going to be in fish also. And so again, removing skin. Some of your fish that are going to have more of the PCBs, and that's PCB is your polycarbonate bisphenols. So some of your fish, your big ones are going to be your bluefin tuna, rockfish, sole, rainbow trout. Those are some top ones there. It doesn't mean you need to totally avoid them, but especially if you're having hormonal changes going on, it's going to be important to avoid those. Other things, healthy liver is extremely important, and I don't think it gets talked about enough. All your estrogens, all your sex hormones have to get out of the body, and it does that through different liver enzymes. And so, for example, like taking a birth control pill will tax a lot of the nutrients and things and these enzymes in the liver that are needed to get rid of these things. And if that starts to happen, the body will say, hey, listen, we can't get rid of the estrogens like we need to. And it'll actually start a new pathway. And these are called 2,16-hydroxyestrone pathways. Big words, but the 16 pathway there, it's one of the biggest promoters of breast cancer. And I think that is huge because it rarely gets looked at. And that's actually a urine test that you can test for these other pathways of estrogen. And if we'll call it just 16, if that 16 is high, your rate of developing breast cancer goes up tremendously. But making sure the liver is healthy by giving it what it needs, and that is going to be a lot of your what are called methylators. And I think, Tracy, you and I discussed this, but we're probably going to do an entire episode on methylation because it's a big thing. But methylation helps to get rid of hormones. So methylators are things like folic acid, B12, B6, SAMe. All these things are needed and get depleted like with things like birth control pills. On top of that, what happens is that the hormones that the body is getting rid of, it's dumping into the intestinal tract. Well, there are enzymes there too that, I say like the liver packages these hormones in boxes and sends them out into the intestinal tract. And there's enzymes that go and take these boxes open and reabsorb things. And so, as we talked about before, this is a domino effect. If there's hormone imbalance, there might be gut imbalance. If there's gut imbalance, these boxes may be opening up too much and reabsorbing hormones that the body is trying to get rid of. And that spells out even more hormone imbalances, more estrogen dominance, which we're seeing a lot of these days. And it's because of these domino effect that's going on. And so, with testing, if someone comes into the office and they've got all these multitude of symptoms, neurological systems, GI systems, hormone systems, we're going to look at all of those things to put together which one of those do we really need to focus on first? Or what's the top 3 that we really need to focus on? Because when you do that, everything else seems to fall into place, right? We don't need to say, okay, well, let's work on the neurology, and let's work on the sex hormones, and let's work on the gut. It may not need to be all of those. It may just need to be a few, and it helps everything else out. So also some other stuff, foods that mimic estrogen or that have estrogen properties to them. That's going to be things like your flaxseed, sesame seeds, chickpeas, tempeh, tofu, of course your soybeans, like the bioidentical hormones get extracted from, and alfalfa. They tend to have estrogen type properties. So depending on what your results look like, actually consuming those might be a good thing, or avoiding them might be a good thing. And that's why we're going to test and not just suggest birth control pill.
I love it. So much great information. And for my readers, you guys know on don'tmesswithmama.com, we're all about getting toxins out of the home, leading a more natural lifestyle, because not only good for your digestion, also good for your hormone health, overall health, just everything. And I've got a lot of great articles, blog posts on how you can make simple changes, everything from using essential oils, right, like what I have behind me, to replace simple things in your home, to making diet changes. So many great things. And I'm so glad that you covered so much of that, Dr. Brady. I think it's really important, because I think for some people, they think, I'm going to get the test, I just need to get on either a synthetic hormone, bioidentical hormone, I'm going to go straight to just the medication route, when a lot of times making the diet and environmental changes can really kind of do most of the work for you. Because like Dr. Brady is saying, maybe it's a signal thing and you're getting exposed to something, or you're consuming something that's interrupting the signal. So I think that's really, really important. And I'm so glad that you're bringing it up. And this is why I wanted to partner with Dr. Brady and True Health Labs, because we're on sort of the same mission of helping women, helping families, to sort of take control of their health, not just take the birth control pill, but actually get a lab test to see, what are the results, what can I do, and get you empowered so you can take that lab test. And if I can make a recommendation, you guys need to, when you get the lab test, opt to get the reading from either Dr. Brady or someone on his team, the lab test reading, so that you can be empowered and take that test to your doctor, and then also get yourself educated on things that you can do. Like I said, we've got a lot of great blog posts and articles here on don'tmesswithmama.com, but that's just one step. You need to take the step on your own as well. So best way to get the test is, I'm going to post a link right here so that you guys can go ahead and get it. And I'm going to post both of the links, the single test and the month-long test that Dr. Brady had talked about. And I'm so excited because Dr. Brady and I are talking about doing some other webinars just like this to talk about other really hot topics as well. So Dr. Brady, thank you so much for your time today. I so appreciate it. You were just a wealth of knowledge, and I truly just love True Health Labs and your mission and everything that you're doing for all of us.
Oh, thank you, Tracy. And I really appreciate you having me on here. And I can't wait to talk about more things. There's a wealth of information that we need to talk about and get out there into the world so people can be empowered and take control of their own health. Our healthcare system won't do it for you. It has its place, but long-term, getting well and staying well, it hasn't got there yet. So I'm glad we're here. And of course you're here, making that happen and giving everyone those tools necessary.
Thank you so much. And thanks everybody for tuning in. So appreciate you, and more links and topics to come. Bye.